Hi everybody, this is Dr. Uzi Chen, and I would like to take some time to demonstrating point location of the kidney channel as it relates to the lower extremity. We need to establish a few body landmarks that are important, because once we know where those body landmarks are and how to find them, then finding the points is going to be much easier. Okay, so I'm going to start using probably the red stickers for body landmarks, and then we'll talk about finding the entire points. So if we look into a patient that's actually on their back, what we call supine position, I'd like you to be able to look into the medial side of the lower extremity foot, right? It's important to recognize that we have the what we call the first metatarsal phalangeal joint right there. So let's put that prominence right there. Okay, first metatarsal is going to go right there, and that's the head, that's the base. Okay, we're going to then put another sticker for that right there. That's the prominence of the base of the metatarsal. And then we want to be able to demonstrate or find an important prominence. That's the first real big prominence we find after that guy. Okay, that's going to be the navicular bone, which is super important for us to know where kidney 2 is. Okay, so the first metatarsal phalangeal joint right there, the base of the first metatarsal, the navicular bone prominence right there. Let's also measure, or let's put a sticker on the prominence of the medial medial malleolus right there. That's where it's most pronounced, right there. And then I would like to also put a point where the calcaneus ends. So if we travel the calcaneus, we have the Achilles tendon as it makes its way to attach and spread over the tuberosity of the calcaneus right here. If you go anterior to that, you fall off the tendon, you make your way in, and somewhere right there, that's the superior border of the calcaneus on the medial side. So let's put a different sticker. I want to put like a blue sticker here for a moment. Now, let's talk first about points that are associated with the kidney up until that region. We have quite a few. If you take a look into the sole of the foot, when we consider finding kidney 1, the thing to do is to find the base, if you will, of the second and third toe, just between them. That's one of the points we're going to be measuring from. And the midline of the heel, that's going to be another point. So these 2 points would form a line that sort of like goes into that makes the sole put it in half, right? If we take that line and create thirds, where the anterior third meets with the medial third right there, that's our kidney 1. Okay, it also usually comes nicely with being more proximal to the padding of the forefoot. Okay, what we call the balls of the feet. So we have one padding, another padding, if you will, medial and lateral, and then right there. Let's check ourselves again between the second and third toe, from the edge of the heel into thirds right there. That's going to be our kidney 1. Let's measure. Let's put that kidney 1 here. Good. Right there, a little bit off right here. Good. Kidney 1. Kidney 2 defined as just inferior to the navicular bone. So if we know where the body landmarks, we can use a couple of fingers. So my middle finger is going to be looking over the spleen line, right? So if we talk about the first metatarsal bone, where we are just like inferior and proximal to the base, to the head of that metatarsal, that's where we're going to find spleen 3. Okay, when we go up towards the base of that same metatarsal, we're going to find distal and inferior, we're going to find spleen 4 right there. As we keep on moving up, we can start finding the medial cuneiform bone, and then where that ends, we find the more pronounced tubercle, if you will, of the navicular bone. So for kidney 2, we're going to go just below that, just inferior to that. And then we can either go here or slightly anterior to find the border between the medial cuneiform and the navicular bone. Which one is more tender? We have A or we have B. Both are very close. Usually people would go right below the prominence of the navicular bone. So we'll put kidney 2 right here. Clinically, I will go with the one that's more reactive for people. Great point. Okay. Now, when we talk about kidney 3, if that's the prominence of the medial malleolus, and that's the posterior aspect of the Achilles tendon, half the distance, and have the patient maybe dorsiflex just a little bit, that's fine. That's going to be our kidney 3 line right there. So again, half between, let's put kidney 3 there. I'm going to put that in right there. Perfect. I want to make sure that I'm not kneeling into the actual Achilles tendon, that I'm not too close to the tarsal tunnel where the neurovascular bundle goes. Kidney 3. Kidney 3, and then moving into kidney 4, it's better that we talk about kidney 5 first. So kidney 5 is 1 zone exactly inferior to kidney 3. So if we talk about 1 zone being 1 thumb's worth, you want to be still above or superior to the calcaneus border. So we just jump that sticker. That's still on the bone, just slightly more superior. It's a tender area for most people. That's our kidney 5. To find kidney 4, we're going to halve the distance and then more and move posteriorly till we are anterior to the tendon of the Achilles. Okay, so right there, that's going to be kidney 5, which is the low point. Sorry, kidney 4. So kidney 3, kidney 4, which is usually about half a zone below kidney 3, and then kidney 5, which is 1 zone below kidney 3, on top or superior to the calcaneus bone. Okay. Perfect. Let's stop here for a quick moment. Okay. We're going to now move into finding or locating kidney 6, which is tricky, and then we'll go into the rest of the channel up to kidney 10. So for finding kidney 6, we know it's on the medial aspect of the leg or of the foot. We have the prominence of the medial malleolus. Kidney 6 is defined by Deadman as 1 zone inferior to that body landmark. Okay. However, I can take my thumb and sort of like be in the ballpark. What I would like people to be aware of, there are some ligaments that holding stability between the calcaneus and the tibia or the medial malleolus, which belongs to the tibia. Okay, so when we go about 1 zone, which is about 1 thumb, of course not mine but the patient's thumb, I want to be able to find a sensitive region between those ligaments. Usually it's right there. Okay, right there, it's about where I would find kidney 6. Some people would look to go below what we call the talus bone. So the talus is going to end here, and then right underneath there's like a shelf. You can also go here. So whatever is more reactive on a patient, either there or between the 2 ligaments, which is more like right there, that's our guy. That's kidney 6. So again, how we found it, we have the prominence of the medial malleolus. We go about 1 zone, and notice that that varies. What is important is that measurement from the bottom of the foot is 3. So you see, we still can argue that it's about the upper third of that distance, which is good. So 1 zone for that for our patient here, between the 2 ligaments, you can find a little bit of a crack, if you will, that is very sensitive. That's kidney 6. Another option, just go a little below that, under that talus. It's another very sensitive area. That's another kidney 6 that is acceptable for a lot of providers. I usually go with that, which is Deadman's definition. So kidney 6, again, we have kidney 2, kidney 3, kidney 4, kidney 5, kidney 6. Kidney 7 is going to be 2 zone above kidney 3. But to be able to find it, one option is to find, like from the medial malleolus, we can put those 4 fingers, and then we have 3 zone measurement. That's common. Okay? However, if we look into that, that's sort of like 3. That means that's 1, that's 2. So we're going to be around here. That's the easy way. Now I'm going to position it just because, and I want to be able to see if I'm, correct with that. So around there, that's kidney 7. It's usually a tender spot. Another way to actually verify is to consider kidney 3 and then move up to the kidney 10 area between the 2 tendons of the semitendinosus and semimembranosus. We'll be able to feel it way better when a person is face down. However, we can tell it's right there. So from here to here, that's the line we're going to be looking for all the kidney points. So kidney 7, except 8, but 9 is also going to be on that line. So it looks about the same line, and that's okay. We want to establish 2 things about kidney 7. First, it has to be on the anterior border of the Achilles tendon. We don't want to kneel into the tendon, it's painful. we're going to go a little anterior. We follow the tendon right there. That's kidney 7 if we are indeed 2 tsum above. Okay, we can see that it's about right. Okay, so I'm right with my guess here. Now kidney 8 is going to be just posterior to the what we call the shin bone or the medial tibia. Okay, so that's the bone moving off the bone. Usually it's about half a tsum difference. So let's put kidney 8 still 2 tsum above kidney 3, but more anterior to kidney 7, about half a tsum anterior. Okay, it's a sensitive region. So kidney 3, and then kidney 7, anterior to that kidney 8. Now kidney 9 is a little bit more tricky, and then going back into that kidney 10 measurements, we have kidney 3. Question here is, what is the actual measurements here? And some people learn that as, well, spleen 9 to kidney 3 or medial malleolus is going to be equal 13 tsum. But in my experience, spleen 9 can be here, can be here, can be here, can be here. It's very difficult to have something very easy because there's a nice neck, if you will, of the medial tibia bone, and it's hard to point out there. What we know about kidney 10 is that it's roughly within the knee crease joint or the joint line. Okay. What we know is that from the joint line to the lateral malleolus is going to be 16 tsum. Because the medial malleolus is a little bit more superior in relationship to the lateral malleolus, and because we're basically are located a little bit more to the, like the joint line from Xi'an goes here, 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 I would argue that it's okay to consider that to be slightly less than 16. Let's put it as 15. When it's 15, that means that if we take thirds and stay on that line between kidney 3 to kidney 10, we're bound to find kidney 9, sort of like right on that line, which is also tender. So I'll put kidney 9 here, right there. Again, not on the muscle, but a little anterior to the muscle. That's my kidney 9. Some people would argue that it's almost like going to the medial gastroc tendinomuscular junction. So they might look for some reactivity here. We do it a lot when we treat the lower leg, if you will. And it's not wrong, but according to the traditional approach is 5 tsum up. I measured that one from kidney 10 to be about 15 instead of 16, which means if I do thirds, I'm going to get roughly to the kidney 9, which is 5 up, and that's also on the line between kidney 10 to kidney 3. Okay, let's just finish up with kidney 10. Kidney 10 is, again, is on the knee crease. It's defined as in between the two tendons of the medial hamstrings. We have two. We have the semitendinosus, which is the most pronounced tendon, with more medial, and we have the semimembranosus, which is a bit more lateral. There's a pocket just between them. That's our kidney 10. Much easier to get to from the back. So that's it for now.